Is it stuck? Should I do it? No, it's clear now. All right, guys. I hope you're prepared. Very much nice and fine. Doing great. So, as you know, we have Pharmac grand finale today. It means all of the subject. It is a subject-wise test. And we have prepared 20 questions for you. It's gonna be a mix and match of all of the high yield topics, and mostly we've presented to the PYTs, more like along with PYTs. So we'll start the quiz within 5 minutes. That's exactly at 10:10 p.m. Guys, if you have any kinds of doubts or anything that you want to ask regarding the future quizzes or just for today as well, you can ask in the YouTube live section. We'll be answering your queries now. Any feedback, anything that you would like to share, do let us know now.
Okay, in YouTube, Talk has asked how many revision as per schedule. So I think we'll have one more round of quiz. Uh, Sir will decide the schedule. He'll send it in the group.
So guys, as of now, we'll be mostly finishing the first. Yeah. All right, guys. As of now, we'll be finishing the first round of revision by mid-March, and then the second term of revision will be starting, and it will be more faster. So that we will let you know the schedule and how many of it, how many number of revisions, we'll let you know.
1 minute more, we'll start the quiz. In case anyone has not joined the quiz, please join the quiz using the QR code, or you can directly go to the link in the Telegram group.
All right, guys. So it's 10:10 p.m. It's time to go into the action that you have been preparing for the past 1 week. So let's get started. Yeah.
Yeah, we'll start the quiz.
All right. Let's go, guys. So welcome everyone to another round of exciting Juxtamed quiz. Today we have the grand finale of pharmacology, and we are bringing in some tricky clinical and pharmac questions. So let's see if you can crack them. Let's get started. The first question in front of your screen now. A 50-year-old woman with schizophrenia presents with resting tremors, rigidity, and bradykinesia. After 3 months of starting an antipsychotic, which of the following drug is most likely responsible?
So, guys, this effect is more commonly seen with first generation antipsychotics. Okay.
And to give
So,
you another
yeah.
cute clue, that would be that it mimics Parkinson disease. The side effect mimics the Parkinson disease. Haloperidol is the right answer. All right, so moving on to the leaderboard. All right, guys, so good going. We'll see in the further questions how you guys perform. Second question.
Yeah, 35-year-old male is brought to the emergency room unconscious with pinpoint pupils and respiratory depression. Which of the following is the drug of choice for immediate management?
One could say this is the most common toxicity seen in drug abusers.
Yeah, reversing this overdose requires an opioid receptor antagonist.
I've told you the mechanism, I've told you the common part. You should know now. Naloxone is the right
Yeah,
answer.
right.
And if you guys do know, just let us know which kind of toxicity are we talking about here. What is the specific toxicity that you know? You can always comment in the YouTube live. Let us know. We'll wait for like more 1 minute or 2 minutes in case you guys know.
If we have Sweetie giving morphine, I think she has told morphine.
Hmm. Morphine, okay.
Okay,
Okay.
let's move on to the third one.
Opioid, right. Yeah. So a young male with glucose 6-phosphate dehydrogenase deficiency develops hemolytic anemia after being treated for malaria. Which of the following drugs is the most likely responsible? We are asking over here is the drug that is responsible causing the G6PD deficiency.
Yeah, this drug generates oxidative stress in RBC, leading to hemolysis.
And it is often given to patients after a heart attack or a stent placement.
Yeah, the right answer is Primaquine. Okay.
Right, right, right. All right. Mm. Guys, you can see the competition is cutthroat between Sureen and Aditi. Let's keep up the pace, guys. Each question gives you marks. There are no negative marking. Please just answer. Just answer. No one is going to, it's not a viva. It's not anything, making you feel negative about anything. So just feel free
Okay.
to answer.
We have Asad Chiranjeevi giving us an answer in YouTube Live. That is opioid. Yeah, you're right.
Right. That's right.
To the previous question.
Right.
So let's move on to the fourth one. A 40-year-old farmer is brought to emergency department with salivation, lacrimation, urination, diarrhea, bronchospasm, and bradycardia after exposure to pesticides. What is the best initial treatment here?
Hmm. Okay, these symptoms suggest excessive cholinergic activity. What do you think, Dr. Manoj?
Yeah, yeah, the antidote here blocks the muscarinic receptor, but a second drug is needed to regenerate the acetylcholinesterase.
Hmm. Wonderful. We just told you the mechanism of atropine, and this is great. So, moving on to the leaderboard.
Yeah, amygdala is right. It is OP poisoning.
Hmm. All right, guys.
We have Krishna now, followed by Aditi, Suren, yes, Shanmugapriyan, Madara, Aisha, Amygdala, SM, and Ashish.
Guys, it's a cutthroat. Let's move. Let's keep the pace. Fifth question. Which of the following best describe the mechanism of action of clopidogrel? What is it?
So this drug actually prevents the platelet aggregation, okay, by inhibiting, I think that is the question here.
You were about to tell them the answer.
Yeah.
Come on, guys. It's a basic neonate question. It's a mechanism of action question. And we all know in Pharmac, they love asking it. Wonderful. Nice.
Yeah,
No.
it is ADP receptor. I think P2 vital specific, to be specific.
Hmm. Yes. All right. So
Okay.
Krishna is holding the longest streak.
Moving on. A 30-year-old pregnant woman at 32 weeks of gestation presents with BP of 160 by 110 and with proteinuria and headache. Which of the following drugs is most appropriate choice for the acute BP control?
All right. So this is a drug that acts by enhancing GABA A receptor activity. And if you
And
want to,
this, yeah, continue.
in case you want the antidote, it is benzodiazepine receptor antagonist, and that is labetalol, which is the right answer. So great going, guys.
Okay, not much changes. the leaderboard. Let's move on to the next question.
Right. So we have a young female who's brought to the ER in a comatose state with hypotension and respiratory depression. His friend reveals he took multiple alprazolam tablets. Which of the following is the most appropriate antidote? So someone has OD'd. What is
Yeah,
the
so
answer?
this
Yeah.
so this drug acts by enhancing the inhibitory neurotransmitter that is GABA. Okay, so a
Right.
classic question, I guess.
Yeah.
Yeah.
Wonderful. Wonderful. All right, guys. Let's keep moving forward. Now the tables have turned. Now we have Aditi having the longest streak along with leading the leaderboard as well, followed by Suri, then by S, then Krishna. You guys are doing great. Every one of you are doing great. Just read the question and you'll do fine. I mean, answer as well. Don't forget that. Okay.
Okay, a patient with rheumatoid arthritis on methotrexate develops oral ulcers, pancytopenia, and hepatotoxicity. Which of the following is the best antidote?
So I hope guys you know that methotrexate is a dehydrofolate reductase inhibitor, which reduces folate availability.
And this antidote is reduced form of a
Folic
compound that
acid.
bypasses the enzyme
Yeah,
clock.
yeah. That
Yeah, it
is
is leucovorin. Nothing
wonderful.
but folinic acid.
Hmm. Right.
Okay, so we have amygdala who has given us as benzodiazepine toxicity. Yeah, you're right.
Nice guys, nice. Ah,
Okay, we have RDT, Suren, SM, Krishna, Ashish, Aisha, Vasan, Thor, CTK, Shanmuga, Priyan, yes, Amygdala, Rakshaya. Okay, guys. So moving on to the ninth one.
okay. A patient presents with bradycardia, hypotension, and hypoglycemia after an overdose of metoprolol. What is the initial best management?
So as you know, metoprolol belongs to a class of drug that reduce the heart rate and contractility.
And we need this drug that, but we need a drug that will increase the heart rate and improve cardiac contractibility and is often used in beta blocker activity. Glucagon is the right answer.
Yeah, not much changes again. Let's move on to the 10th question.
Guys, we are in the between of the quiz. So your question is
A 30-year-old male undergoes general anesthesia with halothane and succinylcholine. Intraoperatively, he develops hyperthermia, muscle rigidity, tachycardia, and metabolic acidosis. So, what is the drug of choice here? So,
DOC.
can you tell us what the condition is here?
Yeah, that's the first thing to diagnose. And second, I would say that this is rare but a life threatening reaction linked to defective ryanodine receptors. Nice.
Yeah, the choice is dantrolene sodium, right?
Nice. Fadafat. Faf. Well, couldn't get his name. All right, guys. So we are in the mid of this quiz. Let's keep the pace. You guys are doing great. So moving on to your next question.
Yeah, Tanya has given us the right answer. That is malignant hyperthermia and
E.
amygdala as well. Also, Sabadinath.
Something
Right, guys, you're right.
nice. Good going, guys. It seems that you guys have prepared well, and this does show it. So it's great. All right. So a 65-year-old male is admitted with septic shock due to pneumonia. His BP is 80 by 50, despite IV fluids. His serum lactate is 5, and okay, and urine output is less than 0.5. Okay. What is the most appropriate vasopressor?
So the drug of choice acts on a alpha 1 receptor to increase BP and improve the perfusion. Okay. Yeah, it is norepinephrine. As you know, we cannot give dobutamine here because the BP is very less, and also low dose dopamine does not help in this. Only GFR is increased. So the answer would be norepinephrine.
Wonderful. Remember, guys, these topics, these
Okay, we have, yeah,
yeah, these questions are your NEET PG's previously asked questions. It is slight modification, just the name of the age, just that difference, but mostly we've kept it as in a similar fashion so that it's a quick, good revision for the upcoming exams.
okay, moving on to the 12th question. 50-year-old patient with hypertension is prescribed propranolol. The bioavailability of oral propranolol is low due to first-pass metabolism. Which of the following is the primary site of first-pass metabolism? A very easy question.
Yeah, come on, guys. Like, baby, neonate. This is like the question where you scored like full. No mistake at all.
Yeah,
We are not gonna give you the clue. You got to know this one.
yeah, yeah. It's liver.
ये lungs कहाँ पे आया? Lungs में कोई metabolism नहीं होता. All right. So liver is the right answer. Moving on. Ooh. So we have Vasan with the longest streak. Where is Vasan?
I think he is in the fifth place.
50. Yeah. Oh,
Yeah.
nice, guys. GG. Let's keep the pace. Moving on. Okay. So a drug has a very low volume distribution. What does this suggest about its property? They've asked you like such baby question, Baba.
No clue required.
No. No. Guys, this is like the base of your Pharmac, the first chapter. I know. Too much, but if you quietly understand, it's easy peasy.
Yeah, it is high plasma protein binding.
Fine. It really
Because the more the drug is bound to plasma protein, the lesser will be its distribution into the tissue. It will be in the vessel only.
right. And this is a property which is common highly in protein bound and hydrophilic drugs. So if you wanted to know,
Yeah.
acha chalo, just give us an example of low VD drug. Let's see if you can get it. We have told you also which kinds it is gonna be. Let's give it a
Okay, we
minute.
have
Yeah.
SM now who is leading the quiz, and Thor in the second place, Suren in the third place, followed by Krishna, RDT, Vasan, Aisha, CTK, Amygdala, Rakshaya, Ashish, H, yes, Monto, Madara, Shanmugapriya, and Hemant, Ram, Bhagya. Okay.
Ram, Bhagya, Reddy, or do you ever think this way that the ready is always ready?
Maybe.
All right,
Okay,
guys.
let's move on to the 14th one. A 25-year-old male presents to ER with acute severe asthma. He is tachypneic with audible wheezing. Which of the following is the first line drug for his management?
So as you know,
So he has severe asthma. Yeah.
yeah, yeah, please.
he has severe asthma, right? So
Yeah.
the and is in tachypnea.
Mm-hmm.
So the faster onset drug has to be used here.
Mm-hmm. No other way to say, but it has to be a bronchodilator, and you guys have done it right.
Yeah,
Good.
can you tell us why Montelukast cannot be used in this case or in status asthmaticus?
Would they know? Let's see. Do they?
Here we have SM leading, followed by Thor, Suren, Vasan, and RDT.
Mhm.
Yeah, amygdala has given the answer beta 2 agonist. Okay, can you tell us why Montelukast cannot be used in this condition? Okay, shall we move on to the next one?
But can you see the tables have turned? Now we have SM leading, and then there was Thor. This Thor now.
Yeah,
Thor. Where is this hammer?
okay. Uh, a, fif- a 55-year-old male with chronic asthma again is prescribed fluticasone via MDI. After a few weeks, he develops white patches on his tongue and inner cheek, which can be scraped off. What is the first line treatment for this condition?
Guys, you got to tell us which is this condition first so that we can tell you that it is the fungal infection caused by Candida species. Now tell me.
Yeah, guys, the question was what is the first line treatment? I know the answer, the drug of choice would be oral fluconazole, but for any mucosal involvement, we can use nystatin here.
Yeah. To emphasize, we've asked you the first line treatment. So, actually, did you get the condition name? Have they told us the condition name? Not
I think they got it.
nice. Yeah.
Okay, in comment section, we have Sabarinath giving us the answer that can't be given drug orally in status asthmaticum. I think the better answer would be Montelukast is a short, think slow onset drug. Okay, we cannot use it in emergency condition.
Right. That is right. And
And
amygdala,
amygdala,
yeah.
yeah,
Amygdala and Sabrina have answered it right. It is
yes, yes.
yes, it is candidiasis. So now moving
Okay.
on. All right. So a 65-year-old male with osteoarthritis has been taking NSAIDs for chronic relief. He now presents with epigastric pain, black stools, and anemia. Upper GI endoscopy confirms a gastric ulcer. Which of the following drug is the most appropriate for preventing NSAID-induced ulcers? This is another baby question, and you guys got to know this.
Hmm.
See, as we know, NSAID inhibits prostaglandin synthesis, which normally protects the gastric mucosa.
Yeah, the right answer is misoprostol, which is PGE1. Okay.
Right.
Most nine of them have chosen omeprazole.
So, guys,
No.
it's a baby, I
Okay,
know. That's been
yeah, we have a close competition between SM and RDT. Also, Suren is in the
mm,
third place, followed by Vasan, Aisha, Thor, Amygdala, Ashish, H, and S. Okay.
and in the 10th position, we're competing well.
Yeah. Okay. Asadi Chiranjeevi has given the answer oral candidiasis. Yeah, you're right.
Good going, guys. Good
Yeah.
going.
Moving on to the 17th question. A 70-year-old male with history of hypertension and type 2 diabetes presents with dizziness and syncope. His heart rate is 38 beats per minute and his blood pressure is 90 by 60. ECG shows sinus bradycardia. Which of the following is the first line drug for the treatment?
All right, guys, just for a little hippy jippy, tell us what is a normal heart rate? Just tell us.
You've asked very tough question.
uh, no?
Yeah, it is atropine, okay? Atropine is the drug of choice, I guess, for bradycardia.
Yes, yes, that is right. All right, so moving on to your second last question. Take a deep breath now because now is the right time. Because last last three questions, and then we'll see the winner. So we have the question: a 28-year-old pregnant woman at 10 weeks of gestation is diagnosed with Graves' disease. Which of the following is preferred drug for treatment during the first trimester? First trimester, 10 weeks gestation, diagnosed with Graves' disease. What is it?
So it is an enzyme blocker, okay? Inhibitor.
Mm,
So there may be two answers here, but trimester is very specific. Only one drug has to be
one.
given. Yeah, it
Yes.
is PTU.
Wonderful, guys. Wonderful. All right.
Can
Let's.
you tell us, can we give propyl thiouracil in the second and third trimester? The comment section.
And can you?
Let's see. Okay.
And guys, for the um methimazole, it is avoided in the first trimester because it has a tetragenicity. It has toxicity in it, and that is why it is contraindicated. All right, it's most likely avoided.
Okay,
So
amygdala has given the answer. 60, 90 beats per minute.
nice.
Okay, Umar Hussain has. Okay, it is right. It is propyl thiouracil. Asadi is telling no, and Ananya also because if we give propyl thiouracil in second and third trimester, it is known to cause fulminant hepatitis. Okay, and in the other case, if we give methimazole in the first trimester, then very specific side effect known as aplasia cutis can be seen. Okay, in the scalp, right?
Right.
And yeah, amygdala is right. She has given the answer, and
Mhm.
she or he, I don't know who is it.
The doctor
Okay,
has
then
given the right answer.
yeah, you're right, guys. Everyone is right here.
All right,
Okay,
guys.
moving on to the
Yes.
19th question. 55-year-old male with type 2 diabetes is prescribed sitagliptin. He asks how the drug helps control his blood sugar. What is the mechanism of action of sitagliptin?
Another BB question, or more like definitely no question. I mean, no means you should know. Okay. So, as you know, sitagliptin inhibits an enzyme that degrades incretin. Now, what do you say about this?
Yeah, it inhibits DPP4. Okay.
Good
If
enzyme.
this is inhibited, then incretin will be increased. That is
Incretin.
GLP-1 and I think GIN. It
GI.
increases the insulin levels.
Right. GLP-1.
Yeah.
Okay. All right, guys. So let's keep up the pace. Moving on to the leaderboard. Fada tough. What? Padative?
Okay, we have
Did he mean sedative?
at the top. We have SM who is leading the quiz, followed by Aditi in the second place, then Suren in third place, followed by Aisha, Vasan, Thor, Amygdala, Krishna, yes, Rakshaya, H, Monto, Ashish, Madra, CTK, Shanmugapriyan, Hemant, Ram, Bhagya, and Fat Tough.
Aha.
Okay, guys.
See, guys, remember.
Okay, in YouTube comment section.
Yeah.
Yeah.
You carry on, then I'll tell.
Umar Hussain is correct. It causes teratogenic effect. That is aplasia cutis. And Sanjay is telling Dr. Rupal's English is too good. And Umar Hussain, you're right. It is DPP4 enzyme inhibitor, right?
Thank you, Sanjay Sanju. Thank you. All right, so guys, let's come back to the
Let's.
quiz. Coming
Okay.
back to the
Last quiz. No, last question. Sorry.
task. These guys will be like, revision ho gaya?
Yeah.
All right,
Uh,
so you want
yeah.
you want to read?
No, no. Continue. Continue.
Okay, fine. So, a 30-year-old female presents with severe unilateral throbbing headache, nausea and photophobia. She has had similar episodes before, and NSAIDs have not provided relief. Which of the following is the most appropriate drug for acute migraine treatment? Would
Yes,
you?
this acts on a serotonin receptor. Okay.
Yes.
It causes screen vasoconstriction. Yeah. Everyone has got it right. It is sumatriptan.
Hey, nicey nice. You guys have done great. Let's have a confetti for them first.
Yeah.
Ooh.
So let's see the winner now.
Yes.
Okay, finally, we have SM as the winner of the quiz today. Pharmac grand finale.
Congratulations, SM.
So, yeah, congratulations. And we have RDT in the second place. Congratulations, RDT. And Aisha in the third place. So, congratulations.
Congratulations, Aditi and Aisha. That is great. And congratulations to everyone as you guys have been here and attempted the quiz. It is great. Let's keep the pace.
Yeah. Also, we have Suren, Thor, Vasan, Amygdala, Krishna, yes, and Rakshaya. You guys did well.
Oh my god, the
Oh,
competition is so cutthroat. We have two people
yeah.
competing for the fifth place.
Yeah, please do give us a feedback as well. So we would love to hear how was the question or any suggestion from your side.
Or like whatever you want in the future times, coming up quizzes, anything that you would like to add or recommend. So we are open to all kind of suggestions. Do let us know.
So that was the quiz, guys, for today. And hope you all had a fun while learning. So until next time, keep revising and stay curious.
All right, guys, stay tuned. Tomorrow will be our site quiz, and be ready. So that way, this concludes our quiz. Until next time, tata, good night, and congratulations to all.